We're going to turn to Andy, but can I take a moderator's prerogative? And Andy, I'm gonna put you on the spot a little bit. I'm sure you're going to like it. Can we do a standing presentation? You know, the public health effects of if you sit too long, it kills you. I'm feeling like I'm sitting too long, so can we do a standing? If you want to stand while Andy's presenting, go ahead. I'm going to stand. Andy, you ready? Yeah, we have one. Be your own Oprah Winfrey today.
Did you put it on my cover?
Look at that. Look at that. I've got it. Good.
Okay. All right. So this takes me back to my years of being a professor. So it feels good. I feel young. Rachel is a hard act to follow, and the DFID What Works program that she's leading, I think, is a spectacular initiative. I want to use speaker's prerogative and ask Rachel a question that I'd like to follow up on, and that is, What Works is developing great evidence. And the question is, what is What Works going to be doing to get this evidence into the hands of policymakers and to make change? What's the communications piece of What Works? So let me introduce myself a bit more and then talk about obstacles to success in attaining the Sustainable Development Goals on violence, target on violence against women. Lisa said I was her favorite guy, economist, I think, so I don't need, that's the best introduction I've ever had. I should tell you I have significant multiple personality issues. I'm a PhD economist, so I have very high nerve potential in common with many people in this room. I am a feminist and have been for a long time. I'm a male heading up a gender and diversity division of a multilateral development bank, which qualifies me as being odd in the extreme. I'm a policy and program person, and I'm a bureaucrat. So I think I have multiple personality going on quite well. So could we get, I'm going to need a remote here. Thank you very much. So I took seriously the title of this presentation of Connecting Research Policy and Practice. And I wanted to start off to asking the question, why do we have a sustainable development goal, the goal on gender equality that includes a target on violence against women? Why do we have it now and we didn't have it in the Millennium Development Goals? Could I ask that the presentation also be here so I don't need to swivel? Okay, thanks. So meanwhile, I'll swivel a bit. I think there are two reasons why we have a Sustainable Development Goal target on violence against women and we didn't before. First is we have a whole heck of a lot more data than we had before. And I'm showing you on the screen, many of you know these. The first is the WHO publication, which for the first time, using broadly comparable data, not perfectly comparable data, got to prevalence rates of intimate partner violence and sexual violence against women by non-partners for world regions. And they pulled 185 studies from 86 countries, 7 on intimate partner violence and non-sex partner sexual violence, 77 studies from 56 countries, and gave us regional prevalence data for the first time in the history. Up on the right part of the screen is from the Western Hemisphere, the Pan American Health Organization, using demographic and health surveys and reproductive health surveys, generated comparable data for countries of the Americas. So we now know that 55% of Bolivian women at some point in their lives suffered physical or sexual violence at the hand of a partner, a staggering figure. And we know that's the highest in the Americas. We know that rates in the Andean region tend to be higher than they are in Central America and in the Caribbean. So we have data that we didn't have before. That's one reason. A second reason, I think, why we have a Millennium Development Goal is an extreme increase in political will of governments to have to consider violence against women to be a public policy issue. And again, I'm drawing on, this is perhaps the most ugly acronym I've heard in my life, MASECVI, which it comes out in Spanish as the Mecanismo de Seguimiento, blah, blah, blah. And then when you explode the acronym, it's even worse. The mechanism for following up on the Belém Convention on Violence Against Women. But the Americas, dating from 1994, has a regional convention which all governments of the region have signed except for two, and I'll let you guess in the question period which those two are. It should not sign the convention, which commits governments to working to eliminating all forms of violence against women. And even better, there's a follow-up mechanism, and this report is issued every 4 years by the Organization of American States. And this, for my money, is the part of the Organization of American States which works best, which is the Women's Commission. And they actually put together a serious report of what's going on in terms of implementing the convention. This is not, those who work in other regions of the world don't have it as good as the people who work in the Americas, but I think there is a significant increase in political will at the government level to consider violence against women a development priority. So that's the good news. It's in the Sustainable Development Goals. The bad news, as Maureen pointed out, is there's so many Sustainable Development Goals, it's not clear that all of them are going to make it down to the country level, and that's an open question. What are the three big obstacles I see to attaining the Sustainable Development Goal target on violence against women? First, data issues aren't solved. I'm going to talk a little bit more about that and in particular ways in which they're not solved. Secondly, and this links to Rachel's presentation, we're woefully ignorant about what works to prevent violence in developing countries. And the What Works initiative that Rachel's leading is huge progress. I'm going to talk a little bit about what the IDB is doing in this area, but we are woefully collectively ignorant. And thirdly, I think national plans are a disaster on average. They're an absolute unmitigated disaster. I'm sorry, I'm speaking as if I were in Las Vegas here, but I hope that's okay. They're under-scienced. I love to use that term since it's been the National Academy of Sciences. They're absolutely under-scienced, and they're underfunded. And there are real reasons why they're underfunded. It's not because policymakers are cruel. I think they're underfunded in large part because they're under-scienced. So despite the progress that I talked about, there's still significant data gaps. Some regions of the world still don't have prevalence data. The Americas is the region of the world I know best. The Caribbeans, I was feeling poetic last night as I wrote this presentation. I think the Caribbean's the Bermuda Triangle of data. And with apologies to Dr. Ward here, who's from Jamaica. And I was going to say, and the UN Women and the IDB working together are beginning to help countries of the region generate prevalence data in the Caribbean, but it's not there. And if you go to regions of sub-Saharan Africa, it's much worse. So there's missing prevalence data. I show you here some time series trends on intimate partner violence from 1993 to 2010. And in fact, there are estimates for the United States of annual rates of violence against women going back to the early 20th century. I don't believe the early numbers very much, but the time series data are there. The number of developing countries for which you have time series data, and I'm using time series very loosely to say at least 2 points in time, is very, very, very few. So prevalence data not available in some countries, time series data available almost in no countries. So there's still data problems. I now want to go to the second barrier, which is that we're woefully ignorant. Mary Ellsberg, one of my heroes in this field, Diana Arango, put together a paper for the World Bank which looked at the level of evidence, how many rigorous impact evaluations were there of programs addressing violence against women. Worldwide, they found 186 evaluations. 70 of them come from 6 OECD countries. And if you look at the graph on the right-hand side, the circle, you see that 5% came from sub-Saharan Africa, from South Asia, 9% from Africa, 2% from Latin America and the Caribbean. 2%, by the way, of these numbers means 2 studies, right? There were 2 impact evaluations of initiatives to address violence against women programming in Latin America and the Caribbean. And there's 1 in the Middle East and North Africa. So we just don't know a lot. Rachel went into a lot of detail about what works. I'm going to go into less detail about what the IDB is doing. The IDB has 9 rigorous impact evaluations of violence against women programming. It doesn't sound like a large number until you compare it to the fact that there are 2 existing now. So if I do my back of the envelope calculations, in 3 years we'll have a 450% increase in the amount of evidence available, but it's still going to be a bit of evidence. Of those 9 impact evaluations, Lisa used this term earlier, there are 7 randomized control trials. There are 2 of them which are quasi-experimental, and we use a bit of a different categorization than what works, but we could also put ours in what works categories. Most of the impact evaluations we're working on are on youth programming. They're on economic empowerment of women, where we're working on a replication of the IMAGE program from South Africa. The IMAGE program produced a 55% reduction of physical and sexual violence against women in a 2-year period. We're replicating it in rural Peru. Safe spaces for women and girls. And Rachel, in her comments, said there's no evidence at all about one-stop shops. Well, we're doing a randomized control trial of our one-stop shop program in El Salvador, or not our program, El Salvador's one-stop shop program called Women's City or Ciudad Mujer, where we used a pretty sophisticated encouragement design, because you probably don't want to use randomized control and withhold services from women. And I'm looking at Jacqueline as I say that, because I think you probably asked me that. Outside on the table is a scandal sheet which describes the 9 evaluations. You're welcome to pick it up. And there are results available from 2 of them, and only 2 of them at this point. One was a program in Mexico to change norms in secondary schools around dating violence, produced significant changes in behaviors, and very encouraging. The Mexican secondary school system, the Colegio de Bachilleres, was excited enough about it. They took it from a pilot program and took it everywhere already. This is a second evaluation which is done, which is a telephone hotline in Medellin, Colombia, combined with police and social services. And this wasn't, again, it's hard to figure out how to do a randomized control trial of a hotline, right? So this was a natural experiment, a quasi-experimental approach, comparing women who got service immediately with women where the hotline either dropped the ball or provided them service after 36 hours. And this natural experience shows that timely attention drove significant reductions in different types of violence, including physical and psychological violence. So the message is the IDB's hopefully making a contribution to the initiative to expand the evidence, the rigorous evidence about what works in prevention and services. I want to turn to my third barrier to successfully attaining the Sustainable Development Target on violence against women. And there may be more, but this is my impressionistic list of the 3 biggies. National plans. They're underscienced. You shouldn't be surprised they're underscienced, right? I just said, in developing countries, there's a tiny amount of evidence available. So it's not surprising that national plans in developing countries are underscienced. They're underfinanced. Generally, and remember, I had a gender and diversity division at a multilateral, and my clients are women's ministries, and they're hardworking ministries, but they tend to be among the weakest ministries in the government structure. And they tend to be the ministries which are given the task of developing and executing a national plan on violence against women. It's in their remit. Of course they should be given that responsibility. But finance and planning ministries aren't known for picking up the phone when the women's minister calls and said, yes, I'll be there right away, and would you like more money? So the plans are underfinanced. And I think there's been a strategic failure on the part of many women's ministries to involve non-traditional actors like finance ministries and planning ministries in the national plans. And I think the worst thing about most plans is that they're not results-based, and hence they don't reward good performance. Now, UN Women has had a significant work program to improve the quality of national plans on violence against women. And don't mean to speak ill of UN Women at all. They've done a serious effort. They've done good work, but I think the needle hasn't moved significantly on national plans. And I think it's serious because I think there's sort of a vicious cycle with low-quality plans. And if we start the arrow with plans being underscienced, national plans aren't making informed choices about what to invest in, right? And the What Works program, Rachel presented initial thoughts on what's promising. At least at this point, we should be investing in promising programs and trying to avoid programs which are unlikely to have impact. And if we're not conducting serious evaluations of what works, we can't document impact. If we can't document impact, finance and planning ministries are going to greet results with a grand yawn. Say, we really don't, you prove us that you're investing our money wisely. And if we can't prove we're investing money wisely, there's not going to be a lot of money forthcoming. And repeat. And repeat. So I think one of the opportunities to intervening and breaking this vicious cycle is beginning to conduct impact evaluations, but not doing impact evaluations just to conduct impact evaluations, but to put, and this goes back to Thomas's point earlier, we develop the evidence, we synthesize the evidence, we make it intelligible in 3 easy steps, or here's effective, here's promising, here's ineffective. And then we figure out how to get it in the hands of policymakers and to do the communication around the evidence that allows policymakers to make smart choices. So those are my 3 impressionistic barriers that stand in our way of getting to better programming on violence against women. And I look forward to questions and comments. Thank you.